Hello, and thank you for joining us today. I'm Dr. Tom Harding, Director of Maui Memory Clinic, and with me today I have Dr. Steve Blake.
Hello.
Our nutritional neurobiologist that we have here. He has presented ground rounds at many hospitals. He's recently credentialed to work in China, setting up hospital programs to reverse disorders using nutrition. He is a prolific author. We're lucky to have him today. Welcome, Dr. Blake.
Thank you. It's a pleasure to work with you here at the Maui Memory Clinic.
Yes. We're excited to have you here and helping patients come in and make big differences in their brain health. And we were earlier talking about the Hawaii prevention trial that we did over on Oahu. And I know that you had used a Ginkgo biloba in the trial. Could you tell me a little bit about why you felt it was necessary to use Ginkgo extract?
Okay. Ginkgo biloba is actually, we use the leaves from, it's a very old tree, ancient tree. And like many medical plants, it's never recommended by American medical doctors or neurologists, unfortunately. It is, however, widely prescribed in Europe by medical doctors and in India and China and all over the world.
Why is that? Why doesn't America get on board like the rest of the world and use it?
Well, for some reason, medical doctors in America don't study medical plants. And it's certainly not because of a lack of research, because the research on ginkgo is extensive. And it's not just cell studies and rat studies, but there are clinical studies involving humans all over the world on ginkgo showing excellent results. In fact, one meta-analysis looked at 9 randomized placebo-controlled clinical trials with humans, and all of those trials showed that ginkgo biloba was helpful not only in preventing Alzheimer's disease, but in treating it.
So the evidence is there that ginkgo works.
The evidence is certainly there, and there's a lot of new evidence too. An expert consultancy was just finished in 2018. Experts from all over the world looked at ginkgo biloba and its effect, and they found it to be the substance most valuable for helping those with Alzheimer's disease. More valuable than, for instance, the drugs donepezil or memantine.
And those are the ones that we prescribe if someone comes in with early stage dementia. Neurologists or primary care physicians are going to, their go-to is donepezil. And you're saying that this ginkgo is just as efficacious or even better?
I would say from the studies, it's better in a couple of ways. One of the studies that came by showed that donepezil, unfortunately, though it's widely prescribed for people with memory problems, they found a 76% increased rate of vomiting and 64% percent rate of diarrhea, which is very unpleasant for people taking it. Now, at the very low doses, like 5 milligrams of donepezil, you don't find much side effects, but at the 20 to 21 milligram level, which is a recommended level, people often do have these terrible side effects.
So for it to have a good effect, I have to take a higher dose that's going to make me have nausea. And I hear that a lot from patients going, I don't want to take that because it makes me feel nauseous.
And there's other side effects such as the agitation, difficulty sleeping at night. You've heard about Alzheimer's patients having trouble sleeping. A lot of times this comes on when they start with the drugs rather than from the condition itself.
And
However, ginkgo improves sleep rather than destroys it. There is no nausea or vomiting or diarrhea from ginkgo. However, it works at least as well in side-by-side comparison clinical trials as donepezil does.
So if I'm a patient and I'm taking 5 milligrams, and if I go up to 10 or 15 and I start getting nauseous, could I ask my doctor to keep me at 5 milligrams of donepezil and supplement it with ginkgo?
You could ask, but I doubt that an American doctor would allow it. Now, one of the reasons why doctors don't like herbs, and I agree with this, is that you never know what's inside a certain herbal capsule. Perhaps it's not really ginkgo, perhaps it's an old dead tree or a tree that was malnourished or didn't get enough water. You don't know if it's good. So in our study, I specified the standardized extract of Ginkgo biloba. Now, the standardized extract is different because it always contains exactly the right amount of what you want out of ginkgo.
So is that like a pharmaceutical grade? Is it safe to say that? Or how is it standardized?
It's standardized. There's one of the desirable components are called Ginkgo flavone glycosides. Okay. And we make sure there's 24% of this pill is Ginkgo flavone glycosides.
Okay.
Another one is a terpene lactones. We need to have at least 6% of the terpene lactones. However, there's an undesirable constituent in the leaf that's called ginkgolic acid, and we keep that under 1% in the standardized extract. So I would not recommend that people take a non-standardized extract form of ginkgo, but it's easy to find the standardized extract form, and it's very inexpensive.
And you make a standardized extract, because I take it. Could you talk a little bit about yours?
Well, everything I just said applies to my standardized extract, and not to all of them, because they standardize on different components differently. The standardized extract that we make is it's inexpensive. It costs perhaps $24 for 90 days, or if you take the full dose that we used in the trial, then it would last 45 days, but still pennies a day.
So that's like a copay. If you're taking a medicine that's going to make you nauseous, it's like the copay. So not much out of pocket, it sounds.
No, and not much profit, so there's not a lot of marketing power.
Maybe that's why the pharmaceutical industry doesn't really advocate for ginkgo, because they're not making any money. It's possible. Okay.
Now, there have been some studies, very interesting, done with both donepezil and ginkgo together. And they found that it improved the patients. So they were taking donepezil and they got a little bump in their memory and thinking power, and they took the ginkgo and they got a bigger bump. In fact, the people who were taking donepezil in that study slowly got worse, but the people who were taking ginkgo plus donepezil got slowly a little better.
Okay.
Just what you would like.
And what about interaction effects? Is there anything that if I'm a patient and I want to start taking standardized ginkgo, is there anything I need to worry about?
There's one thing you need to worry about. The plant itself is perfectly safe with no side effects or any problems that have been noted. And as I say, there's wide literature of that. Many studies showing that people aren't dropping out from side effects. They're not having any trouble. However, ginkgo has a blood thinning effect. And that's how it works. One of its ways, it's also antioxidant and protects the brain. But its blood thinning effects allow the blood to penetrate deeper into the arterioles and capillaries in the brain, nourishing the brain cells, allowing them to get the oxygen and nutrients they need to work properly and not to die off. However, if you happen to be taking blood thinners, prescription blood thinners, such as warfarin, Coumadin, or Pradaxa, Xarelto, Eliquis, any blood thinner, anticoagulant medication, you should not take ginkgo. And I say this only in an abundance of caution. The latest research is showing there's not really such a big problem, but we want to be extra careful. We don't want any bruising or nosebleeds or anything.
Sure.
So if you're on blood thinning medication, don't take ginkgo biloba, but most people aren't, and that makes it one of the safest plants on the planet.
Wow. So if you or a family member are suffering with dementia of some type and they are taking donepezil and they're having trouble with nausea and things of that nature, this is something you might want to look further into. And is that in your book, Nutrients from Memory?
It certainly is. I have a chapter about ginkgo biloba, and I talk about how much we used, what form we used, and the studies behind it that really validate it scientifically as a reasonable solution to helping people with memory problems. By the way, it's not just used for people with dementia. In Europe, it's the most prescribed medical plant of all the medical plants, and guess what it's used for? Memory. College students take it to do better on exams. It helps the brain.
Yes, the memory piece. I took it in college too, absolutely. And I just quit taking it after exams were over. Okay, so anything else that we need to say about ginkgo?
I think if you're not on blood thinners and you're having memory problems, it's certainly something to consider. Please be careful to get only the standardized extract form.
So if I'm having senior moments, I don't need to wait until I'm demented. If I've got a good heart and I'm not on blood thinners and I'm having senior moments, I could take some ginkgo.
I don't see why not. on the one hand, it would be a very good idea to run it by your doctor.
Okay.
On the other hand, he's very likely to say, no, don't take it.
Yes. So the Ginkgo, you can get it here at the Maui Memory Clinic, just like the books that Dr. Blake has out. And of course, I have a book out. It's all here at the Maui Memory Clinic. If you're lucky enough to live Maui.
This is Dr. Harding's book on Alzheimer's disease. Excellent. I've read it carefully.
If you're lucky enough to live in Maui, you have access to everything we're talking about here. It's available at the clinic. Dr. Blake has his vitamins, his Ginkgo. It's all at www.drsteveblake.com.
And that's drsteveblake.com.
Yes, the short form. And of course, it's here at the clinic, so it's accessible. I want to thank you today for coming in. He's a wealth of knowledge. It's just amazing what you can learn with him. And for folks that do come into the clinic, he's available for nutritional counseling, and it will make a world of difference in your memory function.
Yeah, I hope we can help you. Thank you.
Thank you for listening and watching.